what are your thoughts on the fresh graduates who like should they open the clinic right away after graduation, or should they practice somewhere? What are your thoughts on it?
See, even when I was a graduate, like when we cleared internship together, we were also in this confused state what we should do. We were seeing some of our friends, batchmates moving abroad, doing MPH and other stuff. Some of them moving out of the clinical branch, doing non-clinical jobs like medical transcription, staying in India itself. Some were opening clinics, some were studying for our MDS NEET examination as we were. So yes, there was a lot of confusion. But what I found helpful was to talk to my seniors, to talk to good mentors who will lead me in my life. And the best thing what I found is rather than committing very early in life to one professional field or one professional pathway, we must try to explore various areas in our life at the early stage. Like in internship, I used to go to some clinics for practicing, like we call it locum, low income jobs. So we just get some experience of hands-on experience while working on the patient. And I found my love there. I actually found that I want to just treat patients, heal them, be a good dentist, be a good clinician. And that's how, after a lot of hit and trial and exploring many opportunities, I settled down to clinical industry. So my advice for the youngsters will be to explore, not commit to one field very early in your life. Explore, take a year off, ask your parents, take a year off. It's absolutely fine. Understand what drives you from inside, and only follow your passion.